Cincinnati-based Mercy Health is the largest health system in the state, with 23 hospitals and nearly 500 healthcare facilities serving communities across Ohio and Kentucky. As demand for care grew in recent years, so did the pressures on its supply chain, and it became clear a massive effort was needed to thwart overspending. But leaders realized they needed guidance to drive process standardization in order to stay ahead of growth.
The whole organization was structured by which any individual site, and within a site, individual people to the masses, thousands, could place orders and order product without necessarily going through what I'd say a restrictive filtering to make sure it's the right product, the right price, at the right time, and the right quantity. So we had to reevaluate, redesign.
At its peak, 32,000 staff members possessed purchasing privileges. Chief Supply Chain Officer Dan Hurry quickly recognized early on in his new role that in order to get to the bold future state he envisioned, the system needed the right strategic partner.
What's important to me, though, is how do we look at the top relationship, the leadership, the ownership of an organization, and what is their willingness to step forward? And do they have a track record that demonstrates that they've done it before and or they're willing to listen and co-create and then develop and then launch and maybe even trip along the way, but learn and progress.
In less than 1 year after selecting Medline as its primary medical surgical supply partner, product standardization eliminated nearly 2,000 SKUs, a 21% reduction. Distribution hubs also dramatically decreased from 14 to 2.
Supply chains become a greater focus because if you look at your expense lines at an organization, number one expense is typically going to be labor. Labor spread across everywhere and everyone. But in the supply chain, we have a chance to centralize a lot of this activity and zero in on a big target.
The supply chain team is inspired by Mercy Health's mission. By improving margins, more money can go toward those they serve.
I know as I take action, I'm helping someone, right? If we can save $1 million, I know that there's $1 million more that can help someone that comes to Mercy in need, and we don't turn anyone away.
Put Away Ready is another behind-the-scenes program designed to improve storage and space utilization. By taking product directly from dock to stock, more time and dollars can be spent on direct patient care.
Anything that we can do to allow that nurse to engage at a better level, on a personal level with the patient, that to me is what the solution is all about.
Tailoring product modifications to help drive enhanced care and safety across the system is also in progress.
Typically, when you're working with a vendor, even that manufacturer, it's kind of like, this is what we make and this is what you get. So that was refreshing from my perspective, because to be able to say to them, yes, this product's acceptable, but the issue that we have is maybe like the length of the ties were not long enough. Could you work with us to potentially modify it for us? And the answer was yes.
For Dan Hurry, future state will soon be reality as teams get closer to a more dynamic and consolidated physician preference item logistics model and planograms for supply rooms.
If you're not changing, you're staying still. There's no doubt about it.